So my name is Kristel Jordan. I'm a clinical pharmacist with Samaritan Health Plans. And before I became a pharmacist for the health plans, my specialty is actually psychiatric medications. So I was really excited to speak on this topic today about the brain and how medications can affect your memory, but I am on vacation. So we came up with this idea to do a quick little movie, and I hope you enjoy it. All right, so first up, high-risk medications. What is a high-risk medication? This is pertaining more specifically to prescription drugs, but a high-risk medication is one that if you are older, that you have a much greater risk of having an adverse effect from this medication. All medications have side effects. There's nothing that's side effect free. Breathing is not side effect free. So the trick is, what are those side effects? Can they be managed, and how severe are they? Well, as you get older and your body starts to break down more, you become more susceptible to side effects. So there are medications that are considered much higher risk in elderly. Usually what we are concerned about is your risk of falling. You get up in the middle of the night to go to the bathroom and you fall and break a hip or break a leg. The other thing that we're really concerned about is something called delirium. Now that's not dementia and it's not being psychotic, but you can basically look and seem like you're out of your mind. Fortunately, it's not permanent. So in medicine, we have something called the Beers criteria. This is your basic reference that we all use. Now, I looked it up. It's called Beers because the guy who came up with it initially, his last name was Beers. It has nothing to do with the drink beer. But in medicine, all doctors and pharmacists know that if this drug is on this list, then that means it's considered high risk in elderly. One thing you may not know is that Medicare actually tracks the high-risk medications that are prescribed by the physicians that are contracted with them. And they do that because they recognize as well that these are medications that should be used sparingly in elderly people. So some of the medications that are prescription drugs that can cause memory issues, and most of these are also considered high-risk medications, or HRM as we call them. So the first one is a tricyclic antidepressant. And it's really called that because if you're a chemistry nerd and you look at chemical structure, it basically has 3 rings. And so that's how it gets its name. The name is not based on any action that it has on the body. Tricyclic antidepressants are actually great drugs, but they work on many of those neurotransmitters, which that means they have a lot of side effects. In pharmacy, we call them dirty drugs because they're not selective on which types of chemicals they react with. They react with just about everything. It's just how much it reacts. So one of the good things about being a, quote, dirty drug is you can be used for many different purposes. But it also, again, has a lot of side effects. These are antidepressant drugs. I can't remember the last time I've seen somebody taking one of them for depression. However, you will see them with things like for nerve pain, diabetic neuropathy, sleep, trigeminal neuralgia, things like that, phantom limb pain. The one that is the most common is amitriptyline, but some of the other examples that I have are nortriptyline or doxepin. And again, the risk is definitely a huge increase in falling. Yes, they definitely make you tired, so you have increased sedation, and you can definitely get delirium with these. So the second group, anti-anxiety medications. Those are benzodiazepines, and we all know these drugs. They've been around for a very long time. They can increase the inhibitory transmitter GABA. So by increasing a chemical that inhibits things, it means that it shuts things off. And probably the best way to describe that is I think about GABA as the little policeman that runs around in your brain just flicking off all the light switches. And that's really good if you want to go to sleep. And that's really good if you have severe anxiety and you need to calm down. It's also really good if you happen to have seizures and your brain is literally shorting out in an epileptic episode. You take one of these and it shuts all those things off. Now, I don't think it's rocket science to figure out that if you're shutting things off, there could also be problems. So you definitely have increased sedation. Some of these drugs even cause short-term amnesia. So you will see them used like before going to the dentist, or you might see them like if you're going to have some sort of surgical procedure and you're not under anesthesia, but you need to be calm. It's not uncommon to take something like that before you have the procedure, so you're a little loopy, kind of out of it. And then when you're done, you don't remember the stuff that happened. So examples for this are Ativan, which is lorazepam, Xanax, alprazolam, and even things like Valium or diazepam. Another group that I've got here are what we call the sedative hypnotics. We in pharmacy call them Z drugs. This isn't World War Z or Zombie Z. If you've watched any of those shows, they just are kind of a nickname that's become popular that we use in the medical world. So these also work on GABA in a slightly different way than the benzos, but they still are that shutting off mechanism. They definitely increase sedation. They're not really used usually for any kind of anxiety. They're used for sleep. And so that's their main purpose. They can also cause amnesia. And you might have heard some funny stories about people doing strange behavior. So these are the drugs that you hear about on the news, that somebody got in their car and drove to the store and came back and doesn't remember doing it. Or people eating in their sleep. They get up and they go to the kitchen and eat a bunch of food and they don't remember it and all the food's gone the next day. So there have been quite a few stories about that happening with people. And so the most common that's used is Ambien or Zolpidem. So that's the one that you hear the most funny stories about. But there are some other ones as well, like Lunesta and Sonata. So again, these are things that definitely can have effect on your memory and that you need to be careful with. Now, the last group I've got here is narcotic painkillers or opiates. Technically, opiates are not on the Beers list, that list of medicines that are really high risk in older people. I'm not really sure why, but technically they're not considered an HRM. However, these work totally differently. They work on the pain signaling pathways, and it basically convinces you that you're not really in pain. So by doing that, it's affecting your cognition. So it's affecting your ability to think and rationalize. And it also makes you very sleepy. So that's its biggest side effect, is sleepiness. It also causes respiratory depression. That's what we worry about in pharmacy and in medicine. Basically, it slows your breathing. And if you take too much, it can shut your breathing off. It also, and this is something people don't realize, it can decrease not just your cognition, but increase the risk of delirium. You don't see that as much. Probably the best example of that is my own mother. She was on a couple different opiates for a kidney disease, and I always used to tell them, don't give them to her too much, because first of all, her kidneys weren't working, and so she couldn't clear it out of her body at a good rate. And then secondly, she'd become delirious. One day I went to go visit her and she was in her room and she was very upset, very angry at something she believed that somebody at the facility had done, and she was writing a letter to Paul Lindman at Channel 2. So I don't know if you guys remember Paul Lindman. I don't think he's on the news anymore, but she was very intent that she's writing this letter to Paul Lindman, and she's going to report these people, and they're going to be on the news. So I started asking, so how much morphine did she get? And sure enough, that's exactly what it was. And once it was out of her system, she was back to normal, and the Paul Lindman letter became a really funny joke. Okay. All right, so that's it for kind of our main culprits for prescription medications. There are also over-the-counter medications that you can just go down to Bimart and buy that have side effects that can affect your memory. The first one, and probably the biggest offender, is Diphenhydramine. Diphenhydramine, the brand name is Benadryl. Most people know it by that name, but they don't always know it by Diphenhydramine. This ingredient is in a lot of medications. Things for allergies, cough, cold, even some of your sleep aids, they use Diphenhydramine. And the reason is because it makes you sleepy. So this works by inhibiting histamine, which was one of our excitatory transmitters. So it's inhibiting that action, which basically means that it's making it null and void. So you have increased sedation, increased falls, and definitely delirium for sure. This is one that affected my father, where he had a cold, and I was supposed to meet him at church Easter Sunday, and I got there and he wasn't there. And I thought he'd show up late, and he didn't show up late. And so after service, I went to his house, and I was very concerned, and I banged on the door for quite a while. When he came to the door, he was all disheveled and looked completely out of it. And I said, "Dad, what's wrong?" And he says, "I don't know. I took some medicine for my cold, and I feel like somebody slipped me a Mickey," is what he said. And sure enough, I took a look, and it was Diphenhydramine. And that's the effect that it had on him. He not only went to sleep, but he was just completely out of it. He didn't realize it was Easter. He didn't realize that we were going to church, none of that stuff. The good news, again, is once it was out of his system, he was fine. Meclizine, that's another antihistamine type drug, but this one is found in products for seasickness, motion sickness, vertigo, or dizziness. And it causes the same stuff, sedation, falls, and delirium, but it's just in a different product. So like Bonine or Dramamine, that's where you'll find this particular one, and it can cause the exact same thing as Diphenhydramine. So supplements. Before we go into supplements a little bit, I just have to give a quick shout out to the supplement industry. Hopefully, you all know that supplements are not regulated by the FDA. There's good and bad things about that. The drugs that we've talked about up till now, prescription and over-the-counter, are regulated for safety, efficacy, purity by the Food and Drug Administration. Supplements are this weird gray area. It's not considered a food, and it's not considered a drug. So since they're not a food or a drug, the FDA doesn't really have any control. So unfortunately, there's a lot of things we don't know about supplements. So the first thing that I recommend when people are going to take supplements, I have 3 rules as a pharmacist. I learned a long time ago not to just tell people, no, don't do it, because they're going to do what they want to do anyway. So my rules are this. 1, it really shouldn't have any severe side effects or any potentially severe side effects. The unfortunate thing about it is we often don't know what those side effects are because, again, they're not regulated and they really haven't been studied very well. 2, it can't interact with other medications, particularly prescription medications. Again, this information is limited because We don't study supplements and prescription meds together. And then 3, you need to be able to afford it. Some of these things are very expensive, and you could literally be washing your money down the drain because we have no idea what they do or don't do. And if it's really expensive and it's something you really can't afford, then don't buy it. That's my 3 rules. So the first one that I've got, and these are things that I have a question mark on my slide that says, do they improve memory? But they are things that there is some evidence that shows they may have a good effect. So the first one is antioxidants. Most people know what antioxidants are. I have an example here of vitamin C, but antioxidants are things like vitamin E, vitamin C, beta-carotene, lycopene. And antioxidants, just kind of a short definition, are substances that prevent or delay cell damage. So they don't really take away cancer or make you well, but they are things that limit the damage of other things that you either might do or come in contact with. Smoking is a great example. Smoking creates a lot of harmful things within your body. And one of the things antioxidants do is that they help to remove those things and they help to prevent more damage from it. So most antioxidants as well are water soluble, so there isn't really a big problem in taking that particular supplement. You just want to, I would recommend probably like a multivitamin that contains these things, or you can buy them individually. So our second one is fish oil. And there's been a lot of press about fish oil. And there's been a lot of claims about fish oil. They originally started with heart health and cholesterol levels. We still think that some of those things are true, but now there's talk about whether or not they're as good as we thought. There is things even about mood disorders like bipolar I've read about fish oil. And it's not an antioxidant, but it's believed that it enhances the capacity of the antioxidants that you take. So in other words, your vitamin C might even work better at preventing cell damage if you take it along with fish oil. Now it's interesting, just last night, perfect timing, on OPB, there was a great documentary on Frontline all about supplements in the supplement industry. And fish oil was the #2 supplement used by people in this country. #1 was vitamin D, in case you're wondering, but fish oil was the #2 thing. Now, fish oil is great. I think it usually is not an issue. However, it's not side effect free. It can increase your risk of bleeding. It basically inhibits some of your clotting factors, so it thins your blood. So you should not just pick up fish oil and take it without making sure it's okay with your doctor. And if you are on any kind of blood thinners, it's a definite no. If you're going to have surgery, usually you have to stop your fish oil at least a week or 2 before the surgery because of that bleeding. Okay, so our next one is vitamin B. Now there are many vitamin Bs out there, and this is one I actually do highly recommend. B is used in lots of different chemical reactions in your body that have to do with energy, metabolism, also things to do with nerve transmission. They are water soluble, so you cannot take too much. You cannot overdose, and they really have potential to do a lot. They supposedly help with fatigue. I don't know if that's really true. I took it in pharmacy school and I'm not really sure it made a difference, but I tried. And again, if you think about my 3 rules, this is one with really no side effects, really doesn't interact with anything, and it's cheap. However, I was at the store recently picking up some of these, and some of the vitamin Bs were very expensive. You don't need that. I recommend just a B complex. That'll give you all of them. But if you're looking for specific vitamin B that has to do with brain cognition and memory, cyanocobalamin, which is B12, and thiamine, which is B1, are probably your most efficacious when it comes to any type of cognition or brain. However, that being said, you can't get too much, and really all of the formulations that have different Bs in them are pretty good. So this is Ginkgo biloba. This one is probably the most well known as far as some sort of herb or supplement when it comes to memory. So the claims are that Ginkgo increases blood flow in your brain. And if you increase blood flow, then you're going to remember things better. I don't really know if that's true, actually, but that's really been its selling point, is that it increases blood flow. And it's thought to increase them in the small vessels of your brain. Now, the data that's come out about Ginkgo actually shows that it really probably doesn't work. So I used to say, well, you can try it, but it's more than likely not going to make a difference. But the other thing we have since found out about Ginkgo, because this one actually has been studied somewhat, is that it has a high potential for drug interactions. It interferes with something called your P450 system in your liver. And that's what breaks down all substances. And so if you interfere with that system, then that means not just drugs that you take, but even some of your foods that it could affect levels. So this is one that you have to double check with the doctor or pharmacist before you want to take this one. Because again, that drug interaction is a risk. And then the last one I have here that I found some good evidence for is something called Acetyl L-carnitine. Now this is actually an amino acid. So amino acids are what we call the building blocks of life. And some of them are what we call essential amino acids, meaning that you must get them from your food. Your body doesn't make its own. This particular one is not essential, so your body does make its own acetyl L-carnitine. Again, I don't think that there's probably any interaction. It really isn't a bad thing to take an amino acid. I can't think of any interactions with other medications or foods. And the price, I bought this one for $6.99, but I saw some others that were $29. So, I would be careful, I guess, because I'm not, again, for something that's not shown to actually work the way it says, don't spend a whole lot of money on it. But the idea is that it might have a benefit for people who have an early stage of dementia, or the dementia that it's at a fast rate. Again, that's really unknown, but that's the idea of it. My last slide I called Buyer Beware, and I have one example of this. And the reason I put this together is because in preparing for this presentation, I went on the web and I Googled drugs for memory or drugs to help memory, and wow, there is a lot that comes up. Some of the claims and things are amazing, and a lot of them I had never heard of as a pharmacist. I don't think even probably your doctor's ever heard of them, and there really isn't any data at all. So that's why I called this little list here, and this is just a small list. I only picked out the main ones that I saw as buyer beware, because it's a complete unknown. But these are all things that are being touted as things to help your memory. I think it's kind of funny too, the first one, the huperazine A, and I'm not sure if I'm saying that right, is a Chinese club moss. So it's Chinese moss. And then, of course, the one that probably most of you recognize is the Asian ginseng. Ginseng actually is a little bit more popular. This one that I found an example of is called maca. It's a Peruvian root tuber. Now on the bottle, it doesn't say anything. It doesn't say what it's good for or that it may enhance this. The only thing it really says is that it's 100% organic and that they guarantee that. And if it's a root tuber, that would probably make sense. So we don't have any idea. The last one I thought was really interesting. It's called dragon's blood. Now, if I were going to take one, I'd take that one because it sounds cool. But it's actually from a plant in the Amazon rainforest, and this plant emits a red sap. So the red sap, apparently, they use to make dragon's blood. I didn't see that one at the store when I went, but my guess is red sap from an Amazon rainforest is going to be expensive. Just kind of thought that. So